Hello everyone, my name is Christian Summers and I'm a fourth year biology pre-med major from Dallas, Texas. So I currently live in Raleigh, North Carolina. I moved here back in 2013. Today I'm going to be talking about the cancer state profiles, the cancers in North Carolina that are mainly prevalent. And so overall, even though there's been a decrease in the cancer rate in North Carolina over the past 5 years, according to the North Carolina Health Equity Report, cancer continues to be the #1 cause of death for many North Carolinians. So, according to the North Carolina Health Equity Report, the cancer mortality rates in Caucasians is 165 compared to African Americans who have a significantly higher mortality rate at 190.7. African Americans are more prone to having a mortality rate from prostate, breast, and colorectal cancer at whooping rates compared to Caucasians. Also, African Americans die at a rate of 28.3 from breast cancer, which is significantly higher than Caucasians at 19, and also American Indians who have a 20.2 rate. On the flip side of things, lung cancer is also the leading cause of death for many North Carolinians, especially Caucasians and Hispanics. It mainly kills whites and American Indians at a higher rate, and Hispanics than African Americans. So I would say all these contributing factors to cancer is just bad. The total percentage of North Carolinians who could not see could not see a doctor due to cost was 15.5%. Fewer whites face this barrier compared to Hispanics and African Americans, which is crazy. I just believe this the statistic is just not fair, and I just think it needs to be more known that Caucasians have more access to healthcare and just feasible doctors compared to African Americans and Hispanics across the state of North Carolina. And I believe this has to be due to the lack of medical practices and just the extreme cost of health insurance in these underserved communities where these African Americans and Hispanics live in. But also, I think the rise of breast cancer and colorectal cancer and also prostate cancer is higher in African Americans due to the fact that African Americans have more, they like salty foods, they like fast foods more, and then there's also a large amount of fast food places and restaurants in these smaller African American communities where these African Americans reside compared to the more affluent white communities where they have a lot of gyms and restaurants that are less fast food and just more healthy for the body. I just believe this is a main factor onto why African Americans are more prone to get these 3 types of cancers more than Caucasians.